Board, once again,
Yeah.
it's not quick enough on the draw.
It's okay.
No
I
worries.
see there are a number of libraries on the west side. I believe it's all the libraries located on the west side where we do have this program running right now currently. And we're also working with them so that they can also sign up with Super to become official DOPP sites as well. Mentioned this too, we're still providing fentanyl test strips. So anytime you wish to order additional test strips, just email us at osu.cdph@cityofchicago.org. If your organization is only interested in the strips and not the whole kit, you can make that known. We can also provide that as well. This is information about a link. I'll provide the slides for the group, but for Super to sign up to become a drug overdose prevention program, I saw Kathy Monahan is on the call as well. She is a great resource. And you see that there were several $1 million allocated to make this program available throughout the state. And I encourage you to also share this information with other organizations that aren't able to make this call today. Lee also touched upon how we have had so much loss over these past 2 years. And I also want to bring up the topic of grief. Grief is a normal process, and it's okay to be feeling grief, but there are also resources and supports available to help you manage your grief, to share with your clients so they can manage their grief. We have a campaign called Unspoken, trying to address mental health. If you go to mentalhealth.chicago.gov, you'll find resources available where the individual can find the closest mental health facility where they can receive care. And all of the facilities and organizations on the website, they are seeing patients regardless of their insurance status or their immigration status, and we'll have a sliding fee scale going down to 0 based on a person's income. So we really want to decrease or make the barrier as low as possible for anyone who's interested in receiving mental health care. Also on the website, you'll see these are 3 real Chicago residents. They're sharing their story about how either receiving or providing mental health supports has truly impacted the trajectory of their lives. And in the spring, we're going to be adding additional people to share their stories. This is the resource finder on the website where you just search, enter your home address, and you'll find the closest locations, either a community mental health center, federally qualified health center, or CBO that provides mental health services. They'll be listed on the site. Okay, and transitioning to COVID, I went over this diagram last month, the Swiss cheese model. And the idea is that when you incorporate multiple layers of protection, each individual layer is not perfect, but when you compound it and use multiple at one time, your protection is more solid. So whatever each layer is represented by a slice of cheese, Swiss cheese, and you'll see it has holes. So if you have multiple slices of Swiss cheese, you'll see that the holes eventually become covered if you put them together. And here, some of the interventions that we can use to prevent COVID, whether it's staying sick when you're at home or to getting vaccinated. If you use all of these interventions at once, your risk of either catching or spreading does decrease. I included this information because as of today, officially, the federal government is providing COVID tests to anyone who goes to covidtests.gov. You should be able to enter your address and you can order up to 4 kits. It says that the order will ship within 1 week to 12 days. It actually opened yesterday, but is actually officially open today. And I put this slide to remind myself was that for the COVID booster vaccine, before initially we were saying that those who received the Pfizer or Moderna vaccine 6 months ago or more, they're due for their booster shot. But there was a revision, so now they decreased that time interval to 5 months. So if you know of an individual who received their Moderna or Pfizer vaccine 5 months ago or more, they are eligible to receive their booster. If you received the Johnson & Johnson vaccine, it's still at 2 months. So if you received it 2 months ago, you are eligible for a booster. And if you call 312-746-4835, you can share that number with your clients. You can easily make an appointment to have either a community paramedic or a public health nurse come to visit your home to vaccinate the members of the home. Again, information about where to find COVID tests, chai.gov/COVID tests. You may have a more immediate need for testing. And if you go to that website, you'll see where the pop-up test sites, the community-based test sites are located. And just as a reminder, if you want to share information with your clients about the effectiveness of or a piece of information that might convince an individual to get vaccinated, know that those who are not vaccinated, they're about 9 times more likely to be hospitalized and 14 times more likely to die from COVID-related complications. And that's it. I kept it short today. Thank you.
You're not off the hook. We've got a few things in the chat box, Dr. Jasmine. Yeah. So someone was asking about the site. So if you can plop that back into the chat box if you haven't. Yeah. And then we have people that are commenting about the libraries. Someone, Igor from Austin Weekly, thanks for joining us today. He said, I don't think North Lawndale's Douglas Library is on it. Do you know anything about that?
If it wasn't on the list, okay. It should be then in the next round then.
Okay. Thanks for letting us know. And Breaky says Threshold has counselors at the Legler Library Monday through Friday from 3:30 to 5. They have Narcan and they're available to provide Narcan training and fentanyl test strips. So thanks for that, Ann. Amanda Lick says, thank you, Dr. Jasmine. This is an incredible effort in the libraries and all that you and the team are doing to get us to where we need to go. Thank you so much. And Rep Ford, our fearless leader, says, could you imagine if the federal government would treat this pandemic like the COVID pandemic and allow families to order naloxone like the COVID test? And everyone is chiming in saying that's a great idea. Totally agree. And that's all you got there. Thanks everybody for chiming in.
And thank you, Dr. Jasmine. You know, I used the website yesterday to order tests for the home and it worked perfectly. So yay feds. Okay. Yeah. Well, good. Let's move on and appreciate it as always, Dr. Jasmine, and a shout out to your colleagues and the great work that everybody's doing to really inform us about the website. You're listening, which is not a big surprise, but thank you. So we're going to move on to the fentanyl work group update and Vonna Hernandez from Phoenix Recovery Services. Get you unmuted and great.
All right.
Seeing you. There you go.
All right. Can you guys see the screen?
Sure can. Yep.
All right, great. So I'm going to run through this fairly quickly. I have to say, Lee mentioned it earlier on the fentanyl work group, we have incredible people. working with us, Dr. Sorrell, Dr. Huggett, now Dr. Costello, a bunch of people. So I see a lot of them on the call. So I'm going to run through this, and then if there's anything they want to add at the end, because they've done a lot of this recent work with the fentanyl work group. There we go. So the summary of the recent work is we had a meeting some time ago, and Dr. Huggett actually brought up the fact that we should try to get the rapid urine test with the fentanyl panel in it, CLIA waived. And I believe it's already FDA approved, but it hasn't gone through the full process yet. So he reached out to Super. We had a meeting with Super, and I'll go through some of the things that happened after that. So what has happened so far is that we met with Super and Director Jones, and as a result of that, talking about the issues and the barriers we were experiencing with getting people into treatment. They weren't testing for fentanyl, and primarily that's what's in the drug supply, and it was disrupting the continuum of care, right? They weren't able to get into treatment and continue the recovery process because they weren't testing, and so they were turned away. So Super issued a smart alert back in July. Again, the issue is that they're not treatment centers, and detoxes don't typically test for fentanyl, and so people are getting turned away. And so we have to, there's a need to get CLIA waive tests with fentanyl, for fentanyl. And that is a barrier to services. And there are some provider concerns. So we're a provider that are using the fentanyl test strips in urine screens, and we're not using the urine screens to be punitive. It's to help assess and see what the needs are of the program participants, right? It could be a really good tool. And so our concern is that we have a CLIA waiver, and if we are using tests that are not CLIA waived, there is, we could have, there could be consequences for that, right? And so that is the concern, but we're using them anyway. And so during our meeting, let me get to this. The importance of testing. It was mentioned a little bit earlier that in 2020, 82% of Illinois deaths in the state involve fentanyl. And then in Chicago, 91% involve fentanyl. So it is important that we get these tests approved, right? And so with the Super meeting, it was the fentanyl work group, Dr. Costello and her team. And it was really, I was able to see, we all were able to see that the state and the city are working as advocates and partners for the groups on the west side, the providers on the west side. So it was really wonderful to see. And the level of involvement and concern was just absolutely amazing, and their willingness to get in the trenches with us and do the work, right, and do their part was awesome. So the state responses, Dr. Sorrell did a great job of kind of doing some research and looking around and seeing what's happening in other states. And she found that in Massachusetts, the governor requested that the fentanyl test be expedited, approval of the fentanyl test be expedited. In Connecticut, the state legislator requested a state level response to Congress for approval of the fentanyl panels in the rapid urine screens. And we're going to continue to see what's happening in other states around this issue, because of course we're not the only ones experiencing it, and it needs to be a change nationwide. Right. So Dr. Sorrell also found some academic and foundational support of this. The Eleanor Health Foundation, they recommend congressional approval, ASAM. They reported concerns and recommends approval, and they recommend approval as well. And the Journal of Addiction Medicine recommends approval of the fentanyl tests, rapid urine screens, in their work. It could help make pain management more effective. It's, as I said earlier, it's a good assessment tool, right? So the action items, the next steps, we requested that there be an addendum to the SMART alert that was sent out in July, that the state is saying that there won't be sanctions for organizations who use the fentanyl test strips, even though they're non-CLIA waived, right? And then kind of advocate and promote FDA approval for CLIA waived fentanyl urine test at the state level. And then we'll continue to do research as a work group on fentanyl testing, and removing some of the barriers for people. So I saw Dr. Sorrell and Dr. Huggett on. Do either of you have anything you want to add?
Yeah, thanks, Vaughn. I was Tom Huggett, Lawndale Christian Health Center. I just put something in the chat. You know, when I'm seeing patients that are taking buprenorphine, naloxone, or Suboxone, or are in methadone programs, it's very, very helpful to know right away if fentanyl is in the urine, just from an educational standpoint. So I think that even just from that standpoint, I think it'd be really, really helpful to have a CLIA waive test. The tests that we use do not have fentanyl because we have to use CLIA waive tests. and so that's what I could add. Often I do send it to the lab if a patient is curious, or if there's some discrepancy between the patient's history and what is in the urine test that we get in the immediately. And they are people are very surprised when fentanyl comes back. Now, I do have to say this. Now, many of the labs are also testing for different types of fentanyl, not just fentanyl, but relatives of fentanyl. And to show folks that it's not just fentanyl, but relatives of fentanyl that are appearing in the urine can be very impactful for creating behavior change and changing how they approach their drug use. Thank you.
Thank you.
Thank you for that, Dr. Huggett.
Thank you, Dr. Huggett. Dr. Sorrell, do you have anything you want to add?
No, I think that was very thorough, and thank you, Dr. Huggett, as well. We've been happy to be working as a part of the group and the subgroup for fentanyl, and we'll continue to work in developing and motivating change in this way as well, because it remains a barrier.
Absolutely.
So the next meeting of the fentanyl work group is going to be next Wednesday, with the 26th at 10 a.m. We'll get an announcement out today or tomorrow morning, but it will be the same Zoom address as now, because we're using one site, so we don't have to keep doing it, do a new password every time. So, but be on the lookout for that. And I invited the person who does the testing for CRA to come. Hopefully they can make it too, because that's a big push for us as well, and a great resource for us, our Recovery Alliance. So thank you. Were there any other comments in the chat, Veronica?
I'm sorry, guys, I was muted. I was just looking at what Dr. Huggett said, but he reiterated it beautifully himself. And other than that, someone mentioned that those numbers about deaths involving fentanyl are staggering. They truly are.
Exactly.
Thank you so much, Rana.
Thanks a lot. Great work. And I always like to use the fentanyl work group as an example of how the task force and our efforts can be used. If you feel that there's something that has some general, or even if you just feel that there's some concerns that you're having in your practice, in your experience, from whatever viewpoint your experience is, that you want to let the rest of the task force know about, or even convene a group to kind of get a handle on it, we can do that. But the fentanyl work group's a great example of that. And Vaughn came to us, brought this up, and here we are, almost a year later with some really good work. And thank you for super folks around here. The next piece of this is really to talk about the direct intervention outreach. I think that Rep. Ford really hit the nail on the head, is that street level connection to people who are using drugs and the people who love them and hang out with them is very important, because we really can't be designing programs if we don't know what's really happening to folks. So we've been joined by, I don't know if Lou, if you and your team want to have a few words, but we also have family guidance. Dr. Bruni's on, and we also have David Jimenez on, who are also part of the, have outreach vans. So I'd like to hear from everybody that's involved in that. Lou, did you want to start off? Anything that you wanted to mention?
I see that he's there. Let me make sure. Hey, Lou, you're muted.
Hello, can you hear me?
Yeah. Well,
Yeah.
kind of.
Are you by two different devices, Lou? Sound like
We
some
got
Yeah.
feedback. We got feedback on you. Why don't I go and ask David from COIP? Do you want to mention anything from your perspective on what's happening with your vans and other work?
Sure. Thanks a lot, Lee. I guess I just want to mention that we're in the process of doing some exploration of adding to our intervention that we're doing on the west side. Some of you may know that we actually have a medical van that was supported by Super to provide linkage to buprenorphine and other medical care. Actually, it's primary care that we're offering on the van. We tie it to our harm reduction program. And so we actually have two vans out. We're currently out 4 days a week, and we're going to be adding a 5th day very soon. But we've been concentrating some of our work 2 days a week at a west side location on Pulaski and Van Buren. There's an empty lot there we kind of commandeered. It's not used, I don't think, by any business. So we pretty much parked there and been there since the summer, and have been using it as kind of a base of operation for those 2 days on that part of the west side. What we've found is that, we've ended up having to do a lot of overdose reversal while we're there doing harm reduction work and medical care and linkage to MAT. And so what we were thinking about doing, and we've been talking about this, exploring the idea of pitching a tent there to create sort of like a sobering center, a sobering station where people can come since they know we're already there and recover while they're there. And then we'd have access to clinicians, either nurses or doctors that are working on our other van, and to be observed. And it basically would have a space with some places where people can sit down or lounge while they're coming out of their drug use. And then we'd be able to link them to other services, offer food, clothing. And we're in the process of kind of thinking about this project, shaping it out, and identifying where we can obtain some funding, at least for the tent to start. And then maybe if it grows, other types of support for staff. My goal here is to ask if anyone else is interested. We're there 2 days a week, and our thought is maybe making that location a 5 or 6 day a week place where people can come because they know that sobering centered tent is there. We believe that we would need to have other kind of clinical programs involved, or at least someone there with some clinical expertise to provide guidance to peer workers that would probably staff the tent, manage it. And we talked about training those peer workers, at least on doing vitals and kind of basic medical procedures while they do observe. But if anything an issue came up, there'd be a clinician nearby. And so ideally, we would see this as a service tied to kind of another clinical van or clinical program that could be mobile. But anyway, our idea is, we want to pilot 2 days once we kind of figure out how to fund this tent, and then invite other folks that may be interested in managing the tent the other days, to kind of join in and figure out how to do this. so that it becomes kind of a station on that part of the west side for folks, because as you all are aware, Pulaski corridor is really, really high use area, and people doing outreach there see overdose very often. And so we want to offer this as kind of a step to maybe allow people, a place to recover and to access other types of services that your organizations may offer, which is our intention too. So if you're interested, as you know, we're as I said, sketching out this plan. If we get the tent, I will definitely let you all know that if you're interested in kind of moving forward to participate in figuring out how to maintain it as an ongoing service on that part of the west side, let me know. I'm going to put my email address in the chat here. So please feel free to give me send me an email, and then we can move forward. Thanks.
Thank you, David.
Hey, Lee, can you hear me now?
Yes, sir.
You sure
All
can.
right.
Hey, Lou.
Great. And great to see all the participants on board. And I'd like to hear from other organizations. For those of you that's been around and collaborating with us, I'm Lou Sires with the Task Force Outreach Team. And most of you probably have our schedule, our monthly calendar that we send out. And it's really been great to have so many organizations coming out to support this effort. And we'd like to get feedback from you if what we're doing as far as working with the organizations to do warm handoff and channel information to you, if it's beneficial, if we need to do some additional stuff. So I'm more interested in hearing from some of you all, since you all basically know what lane we're in, what we do, and we try and do what we do and do it best. To see if we can enhance that by doing more with your organization. And probably some of the other teammates, my team members are on today. I have a new member that's on. So again, thanks to all the organization and all the supporters for your help and initiatives to work with us out there in the field. Even though it's cold, I see some of you still wrap up and come right on out there with us, and we do appreciate it. Thank you.
Thanks, Lou. Were there any chats related to that once the?
No, Dave actually dropped his email in the chat box right when he got done, and there was someone inquiring about some recovery help, but everybody kind of took care of them right in the chat.
That's fantastic. Thank you, Ms. Fields.
God.
Thank you, Ms. Fields, for bringing that up, and everybody for responding. Dr. Bruni, did you want to give an update on the MAR van?
Sure, yes, thanks, Lee. Hi, I'm Maria Bruni, and I'm with Family Guidance Centers. And as I think we've talked before, the task force before, to let you guys know that Family Guidance got a 5-year grant back at the end of September, early October from SAMHSA to be able to have a mobile medication-assisted recovery, a MAR unit that could actually do, induction on all forms of medication-assisted treatment, all the medications used to treat opioid use disorder. So we actually just recently got the van. It took, as we were the victims of lots of people. Anybody who's trying to buy a used car right now or any kind of car right now knows exactly what we've been going through the last couple of months trying to get this van, waiting for the chips to be sent from wherever. So we finally got the van. And we're getting it ready for DEA approval. We have to have the DEA approve it before we can actually dispense the medication on the unit. But while we're waiting for that to happen, we are going to be able to take the van out to do some of the outreach and do the assessments. And so we're actually working with the task force tomorrow to bring the unit out just for the first time with our recovery specialist who'll be on board, who can do an abbreviated assessment for anyone who might get referred to the unit, who might be looking for treatment, especially for people who are looking for medication-assisted treatment. We can also guarantee that when we have the unit out, we will be able to connect anyone who gets seen on the unit, gets seen on the van. We can connect them to same-day medication. So even though we can't dispense it on the unit right now, we can make sure that we get that patient, get that person to to where they can get the medication same day. So we're not going to have anybody have to wait. So so if the outreach workers are out there and they are working with people who are interested, who would be appropriate for it, we're going to try to connect them right away to medication assisted recovery. So we're excited to start this up tomorrow. And we're gonna then, send out, we'll be working with you guys on the calendar to see if we can, participate in some other kinds of days where the task force is doing outreach. We've been working with several hospitals, with other, with other organizations where we can bring the unit. We're hoping that the DEA approval will happen. We had a meeting with SAMHSA about it actually yesterday, to have them put a little pressure on the DEA to help move this along more quickly. So we're hoping that within the next 4 to 5 weeks that we'll actually be fully up and running. There'll be medication on the unit, and we'll get it all approved and be ready to go.
Fantastic.
You have
Fantastic. Very
one
exciting.
question, Dr. Bruni, in the chat. Someone is asking Yoela, if we have unhoused clients who are interested, what will be the best way to let your team know where they usually are, or will you have set stops?
Right. So since we literally just got the van about 4 days ago, so we don't don't have a usual yet, but we're starting with Luther and with his folks. So tomorrow will be on where the outreach, the west side, where the task force outreach workers are going to be. So how the calendar looks for tomorrow on outreach activities will be our van. We're going to be starting out with with Luther and his team. So tomorrow, that's where we can be located. And then we'll get the information to the task force starting next week. We're going to really be working on kind of coming up with a schedule that makes sense right now, considering we can't keep the medication on the unit yet. We can't lock it up yet.
Great. And Yola, we have if you don't have a schedule of Lou's outreach team, the task force outreach team, that would be a place as well that you could whether it's to Family Guidance or to any other of the providers that we can hook people up with. So any of the other outreach partners want to mention anything? I know Ann said they're going to be over at the Legler Library, which is fantastic.
We're actually over there 5 days a week. We've been there for a couple months. And that is the counselors who work for the Narcotics Arrest Diversion Program. So they start their shift over at the library. And now they have a social worker at Legler through Amita, who's no longer there. So they're available to, we've done lots of on-site training, but also people, again, looking for resources. As usual, people may have a substance use disorder, but they're really interested in housing. So, we're just trying to meet people where they're at. So that's an ongoing resource we can offer.
Thank you so much, Ann. We have a question here from John Warning in the chat box to Dr. Bruni. He's asking, what meds will you be dispensing? MAR meds.
Yeah, thanks. I was just typing there. So no, that's good. I'll just say it. So when we, after we get the full DEA approval for to be able to lock up and be able to keep the medication on board, we'll be able to provide. We will have all 3 forms of medications for the treatment of opioid use disorder. So we'll have methadone, we'll have buprenorphine, and we'll have actually Vivitrol too. So we will be able to store all three medications on the unit.
Excellent. Dr. Bruni, they're asking for you to drop your information in the chat box. You're a superstar.
Oh, sure. No problem.
Julie says, if you have a phone number for us to contact you, thresholds at the police departments could welcome folks to walk in, and we will put them in touch with you. We are at 11th District, Harrison and Kedzie, 3:30 p.m. to midnight. So if you have evening hours, we would really like to work with you. And there's a number from Julie right there in the chat box.
Okay, great. Yes, and I will send my, I'll put my info out there, and yeah, shoot me an email and we can, we when we wrote the application to SAMHSA, we included a bunch of partners who were willing to kind of, support us in that, including Lawndale, Christian, and lots of other folks who, so yeah, we would really, we're going to have this grant for 5 years, so we're really interested in finding more partners. We're at the beginning stages of this, so this is really helpful. Thank you.
Of course. And Carolyn Bloom to Ann Brakey, she's asking if you can put that info in the chat. Sorry if she missed it earlier.
Sure.
Thank you so much, you two.
I bet, I got a feeling that there's a lot of hearts out there that are being swelled with enthusiasm, not only for the specifics of what Family Guidance and COIP is doing, but just the great collaboration. I mean, it really is something else. And, I don't think it's probably happening anywhere I hope it's happening in other places, but, Vaughn and I always talk about how, we want to turn the people's opinion and understanding of the West Side on its head. That we're actually the leaders in all this, not we're not behind, we're actually taking the lead. And I think that's really important for you all to know. Any other of our partners, any other member updates? We have about 6 minutes to go. We don't want to cram this all in, but if anybody's got some information they'd like to share, they can either mention it now live or they can put it in the chat.
Can you hear me?
Yes.
And hi, Ella.
Hi. So a lot of you already know this, but on February 9th, Above and Beyond is having a housing workshops. It's really going to be for tenants to learn about the rights they have. So we'll have lawyers, we'll have our housing people, clients will be able to, or not clients, anyone can come to it and they can come fill out housing applications. And yeah.
Great.
Thanks for that info. If you have anything to drop in the chat related to that, that'd be great.
And by the way, we'll get this in, the part that I recorded, sorry, Dr. Jasmine, we'll get that out. We'll also get the chat. We'll cut out any internal conversations, and Dr. Jasmine's presentation and Vaughna's presentation will be included as well.
Hey, Lee, really quickly, I just wanted to say, speaking about the collaboration and the partnerships we have here, Phoenix is a member of the National Alliance of Recovery Residences. So it's National Organization of Recovery Home Operators, and Ross, right? And so I was telling them about our relationships in the task force in Rep Ford, and they were blown away. None of them have anything like this. So we have a monthly learning collaborative, and Rep Ford is going to be presenting to that group to talk about the task force and how they can develop relationships and collaborate with other providers and stakeholders and people at the state level. So when we get the date pinned down, I'll let you guys know about it.
Fantastic.
Okay.
Fantastic. And I know a lot of the work that was happening predates the task force, but this is the place to be. So anybody else before we leave? And remind me to mention something about our author.
I just dropped that link to the ebook, and the official copies will be available later on this week. But
For what? What official copies of what?
I'm sorry, you're gonna put me on the spot like Rep Ford. You all, my book is covering exactly the type of work that we all do. It's called Hood Healing, and it talks about the trauma in Chicago. And Dr. Sorrell is actually featured in the book. So you guys can definitely relate to her words. Thank you so much for your support. The ebook is right there. There's the link, but I encourage you to buy copies the moment it becomes available on Amazon.
Yeah, so she can sign them.
So I can sign them.
That's great. That's fantastic. And, V's been doing a great job of getting information out, and kind of my right-hand person, or I need a right hand, but also just to help me, anytime I see something, let's get this up. Let's just get this up on social media. And, I really encourage everybody to get, can you put the address for the social media too in there?
Oh, definitely. Follow us on Facebook.
Follow us, because that's where a lot of the information, the late breaking information gets put. We're trying not to burden you with too many emails. So, and there's a lot of stuff coming down the pike. Sue Pickett sends out a lot of information from Super. But we're going to try to put a lot of that up there and really make sure that we've got, you're able to see what's important out there. So
Definitely.
anyway, as my trainer, Al Orselvo said, start on time, end early. We're at 1:58. Thank you all. We'll see you next month. But if you're interested in the fentanyl work group, that's next Wednesday at 10 a.m. We'll get information out. So be looking. Thanks so much, everybody. Have a good one.
All right, Lee, I'm gonna save this chat so that we can make it as a part of our follow-up here. You've got the recording there. You only miss Rep Ford talking about how great you are. That's the only thing we didn't record. You came in right in time. So it's all good. Oh,
Hey,
thank
Peter.
you. Found us on Instagram too. Yay. Instagram and our Facebook is right there. Follow us. Like Lee said, if you don't get our emails, you definitely need to get our inboxes and messages.
Is that the Cynthia Williams or it's the other Cynthia Williams?
The Cynthia Williams. She's muted. Cynthia, you there?
I know it's always the Cynthia Williams, but I'm just wondering if it's Apex Cynthia Williams. Mr. Jackson, how are you today?
I'm fine. Lee, how you doing? Everything's
I'm good.
Okay?
I'm good.
All right.
Yeah, doing all right. Thanks a lot.
Okay. All right. Looking forward to being out there tomorrow.
Yeah.
All right.
Yeah.
See you
All
there.
right. Take care.
Okay.
I think we've got Cynthia.
Hi,
Hey,
Lee.
Cynthia.
Hey,
Hey,
everybody.
that is Cynthia.
How you all
Hi.
doing?
Good.
At the last minute, I just got a call from State Rep Ford. Said, Cynthia, I need you to get on this call. Didn't tell me anything. So
That sounds like him.
I just
Well,
got
hey,
on
listen.
the call. So
Hey, put your put your information in the chat. I got it so you can get the email so you know what's going on.
okay, sure will. Sure will.
Great to
Okay.
see you.
All right. Same here.
Yeah, you are the Cynthia Williams.
See, Cynthia, that's right.
Nice
Right.
to see everybody.
Okay.
Wonderful. I'm not gonna hang up until I get your information in the chat so I can save it one
Okay.
last final time, Cynthia.
Okay, great.
Hey, Lee,
Yeah.
she be getting all our information from one of our team members.
Okay.
Cynthia's up on
Oh,
it.
wonderful. We believe in
Yeah.
word of mouth marketing too. It's just as good as anything else.
Yeah,
Definitely.
absolutely. And got another project he wants me guys to work with you guys on. So I'm not
Oh,
sure
hey.
who the point person is, but my best friend is on. Well, two of my best friends. I see Grady Norwood, but Luther Sias, that's my best friend. And
Yeah.
so is Lee.
That's
So
wonderful.
one of you all give me a call.
Okay.
Whoever the point-
Cynthia, you
whoever
have
the
an
point
email to
person.
drop in the chat box for us quickly?
Yes, I sure will.
Okay.
Okay, I'll do that now.
Wonderful.
Right.
We
Anybody
probably
else
got
with
it. Lou's
the-
probably got it too.
I'm sure
but,
we have it.
It's just amazing how long we've all been doing this, Cynthia. I mean, you haven't aged, but
Well,
you've been at it for quite a while.
42 years for me.
Ow.
Wow. That's something.
42 years.
It's
Yes.
Beautiful thing.
great. It's great. Good recap, Lou. Thanks.
Great work. Thanks, Lou. Thanks for all the book love, everybody. Lee, I'm hopping off for 2:00. I just wanted to make sure.
Okay, take care, everybody.
You need anything else from me, let me know, but we'll recap later. I didn't
Okay.
get an email from Cynthia.
I'll get
so
it. We'll get it. We'll get it.
All
So
right,
you got everything else though? Everything?
I've got everything else.
Okay.
You got the recording.
All
I've got
right.
the chat.
See y'all.
Check you all later.